close attention needs to be paid to staff morale. It's an assertion made by the 5-member committee appointed to investigate COVID-19 treatment within the parallel healthcare system and patient outcomes. Excerpts of the report were read by Minister of Energy and Energy Industries and Minister in the Office of the Prime Minister, Stuart Young, in the Parliament on Friday. The report also noted that international best practice was followed as it relates to the hospitalisation of those infected with COVID-19. Mahalia Joseph-Wharton has more.
The report, which was submitted to Prime Minister Dr. Keith Rowley this week, was laid in the Parliament on Friday. Many concerns about the staff were highlighted in the report.
We recommend that close attention needs to be paid to staff morale as well as the purchase of some consumables. We wish to commend one institution where there was a staff mental health and wellness service by 2 psychologists as an example of best practice.
The committee raised concerns with respect to staff levels, citing shortages and conditions as areas that needed addressing. However, the committee said it recognized that staff shortages are an international problem in the pandemic. An analysis was done on COVID-19 deaths, hospital admissions, and patients managed at home. The committee also looked at the level of care given to samples of patients.
The committee looked into the admission criteria and found that, quote, the admission criteria met international best practices. It would seem that the patients were admitted to the correct location to receive the appropriate type of care. However, the staff told us that it was their impression that during the recent surge, patients, quote of the staff, presented late and as such they were more seriously ill.
Minister Young said the committee was unable to detect any delay in the provision of care which might have led to a negative result. 16 recommendations were made by the committee. Among them are data management systems, data verification. As it said, there is an urgent need for electronic medical records. They also recommended that contracted clinical staff be rehired at the end of their contracted period to respond to the NCD morbidity rate accumulated during the pandemic. Mahalia Joseph-Wharton, TTT News.
Now it's time for a COVID update. Total active COVID-19 cases in this country now stand at 20,731 as the Ministry of Health recorded 624 additional cases. The ministry in today's clinical update noted that these were taken from samples during the period February 13th to February 17th. Meanwhile, 4 persons have succumbed to the virus, bringing the country's COVID-19 death toll to 3,553. The fatalities are 3 elderly men and 1 elderly woman, all with multiple comorbidities.